Hey everyone, so recently I've suffered a meniscus tear. I've got a non-displaced flap tear on the medial meniscus in the main body and a few other little issues that have gone on in my knee because of that. And so I'm doing knee rehabilitation when it comes to my lower body training at the moment. So all my weightlifting, there's a few considerations with a meniscus tear. You can't load the knee in flexion, which means you can't do any squatting, you can't even really do any heavy deadlifting, at least in the earlier phases until the inflammation goes down. So I'm making this video just to show you guys the considerations for meniscus rehabilitation. For training, there's a few things you need to know. Firstly, the meniscus gets very poor blood circulation, so it does take quite a long time to repair, if it is going to repair at all. And secondly is that it also has a very low nerve supply. So often when you feel pain with a meniscus tear, you've already gone too far. So unlike something like a hamstring or a quadricep where you can use pain as an indicator, because there's so many nerves going to the muscles there, so you can feel it before it really gets bad, you don't get that same feedback from the meniscus. So you want to really avoid all knee flexion, all loaded knee flexion, at least until the inflammation goes right down. And you can generally tell that by if you put your finger in here on this little in the little joint in here, and if you feel pain there, then you're still probably not ready for loading up the knee through flexion, so squatting or anything like that. And the other thing that you want to think of is we want to be strengthening the VMO, the oblique portion of the vastus medialis, so you can do all the step-up variations out there. You want to strengthen the calf and you want to strengthen the glutes. I put hamstring strengthening in there as well just to balance out the step-up, so we always try to create balance and stability through agonist and antagonist muscles, so opposing muscle groups for a joint. And there's so many different exercises and variations that you can do for this, and of course periodization is a really important part. So what I'm doing now is not the be-all and end-all. This is just the program that I'm doing for myself for this phase, for this month, before I progress my exercises and go to some slightly more challenging and harder variations. So if you've had a meniscus tear and you're trying to rehabilitate it, hopefully this video will help you. There's a lot of bogus information out there, but I've worked with a friend of mine who's an exceptional physiotherapist, also another friend who's a chiropractor and a masseuse, to get a much better understanding of the meniscus and what's going on in my body now that I've had this tear, and then also my knowledge of how to write programs and rehabilitate knees. So I hope it helps you guys.